Welcome back, guys. I've got an absolutely awesome guest tonight, Dr. Danton Cervi from Woodgrange down in Victoria. Danton, thank you for joining me, mate, and we're going to be talking about OPU and ICSI tonight.
Thanks, Mo, for the invitation to talk a little bit about something that we really like to do and talk about it, something that is also important for us and good to make people more informed about it and don't get any mistakes or anything about the technique.
Awesome, mate. I'm really looking forward to this, and as always, the pleasure is mine to have you on, mate. Just want to ask you, is it cold down in Victoria at the moment?
It's really cold. This week's been really cold. I think it's just like 6, 7 degrees now. Um, so it's
That's
been
a
a
bit.
difficult week.
That's brutal. Just to make you feel a little bit, I don't know how you feel about this, mate, but tonight it's a little bit cold where I'm at as well. But my wife made feijoada for me, and that
Oh,
really
beautiful.
that really hit the spot. So
Yeah.
I had two plates, one for me and one for you as well.
Thank you.
Very heavy stuff. It's awesome. But Danton, let's get into it, mate. Um, Equine OPU. Um, we've worked together for a little while now. We've had some oocytes sent up to us, and on the lab side, I get the oocytes and I do what I need to do. But there's a whole workup that leads up to that point and to OPU as well. Uh, could we please start with the mares first? Um, are all mares suited for OPU?
Well, I like to normally say for our clients when we talk about OPU, what we done here in Victoria is like 10, 20% of the job maybe. The rest is like on you. So I believe it's you're more responsible for all this success than we are here actually. Uh, we
Okay.
try our best, but uh, at the end, the person who do the magic is the embryologist and what's going on in the lab. So I
Part
believe,
part of it. Part of it.
yeah,
Yeah.
it's pretty much a team that need to work in a
Absolutely.
right position with everything on 100% uh, environment, everything going really well to be able to get something. Otherwise, if there's anything go wrong, you're not expecting much at the end of the process, unfortunately.
Yeah. So with mares, obviously their general health, body condition, nutrition,
Uh,
that all needs to be on point.
yeah, so just to introduce a little bit about the process that we run through here, uh, pretty much the most important thing is that's the first step. It's counting follicles. That are going to give us a roughly idea what we can expect in terms of oocytes and in terms of the embryo at the process. Uh, but we also have a couple other things as like the health of the mare, if she's gonna be able to be sedated and how the process gonna go if during the process and just it's just a couple of things that we need to have the attention to details. But what we normally say to the clients, it's pretty much like um, number of follicles. We aiming for at least 15 follicles. Some mares, warm bloods, they have more. Quarter horse have a little bit less, um, but it's just how it is, and we need to work with that we have on hands, and that's the reality.
So there is a difference in the number of follicles that we could see between species. So say warm bloods compared to quarter horses or stock horses.
Yeah, like in my experience, I believe the warm bloods here they tend to have more follicles, uh, but in the lab they don't convert as well in terms of like percentage. In other hand, you have quarter mares that you send like because they have uh, less follicles, you're likely to get less oocytes. But in my experience, they tend to get like good percentage in the lab.
Yeah, that's interesting. And can people do? I think I'd like to think maybe from the side of a breeder that's coming to you. Is there anything that they could do to be increase the number of follicles, or is it sort of out of their hands?
Yeah, unfortunately, it's something that still kind of been researching. Um, we have tried a couple things with some hormones, but it's not something that work with 100% of horses. Sometimes it's just timing. It's particular from each mare, uh, and what I likely to do is giving time. Mare doesn't grow follicles in days; they need weeks. So
Mm,
um, I'm likely to scan them like once a month, sometimes like 2 weeks. So then to see how the follicle population is there. Um, but it's, as I say, it's particular from any horse. Um, you're gonna have mares that clients are pushing up to do it, and you're gonna end up doing with less oocytes, like less follicles, likely get less oocytes. But you need to work with what you have in your hands.
mm, yeah. Um, and leading up to the surgery, well, I guess sort of going back to if you were to selecting mares, or if you have someone that has a number of mares that they want to put through OPU, should they be looking for younger mares to put through the process, or older mares? What have, in your experience, have you seen give better results?
Uh, that's a good topic. They like normally the mares that gonna come for OPU is because they having problem, you know.
Mm.
They have been flushing multiple times, never get an embryo or get an embryo 5 years ago. So it's been mares that have like extremely manipulated, passed through many vets, many breeding seasons. So that's the majority of the mares that came to us to do it. So they normally will have like around 10 years old or more, and it's also timing for them to prove they're gonna be like good brood mares because they have compete or something like that, and people really wants to, like they have a higher valuable mares to become able to like to do a PU. It's a expensive process, so you're expecting to have a um, fall with a good price. But um, I just saw research another day, and uh, really old mares they tend to have less quality outside and not go really well uh, in the ICSI process. But in terms of OPU, in terms of outside recovery, they go same as the young ones.
Yeah, that's interesting. The unfortunate thing is, it seems like in a lot of mammalian species, age is the enemy. The older that, even in humans, the older that people become, or other
Yeah.
species, that just the quality of the gametes decreases. But it's interesting to see that in terms of numbers recovered, it's similar to younger mares. But I think, yeah, that just speaks well to the quality of DNA decreasing with age.
Yeah.
Um, Danton, is is there an age that's too young to do OPU? Would you, as a clinician, be avoiding doing the surgery on mares that are,
Hmm.
of a certain age?
Well, it depends on the breed. I think the youngest I have done was probably around 3 years old, warm blood. So they already big mares, so they kind of support better the process and the sedation, everything. Um, but you also have the ligaments more attached, like the ovaries ligament, so they tend to be more painful a little bit in the process. But many times that's not like a big problem in the practice.
Yeah. Okay. Um, Dan, and I've heard some, I guess, myths about the OPU procedure, and I wanted to double check this with yourself. I was having a chat with Tish Healy the other night, and one thing that was a question that was raised, and I'm not qualified to answer this, but um, can OPU, assuming it's done correctly, lead to mares becoming infertile?
Oh, no, definitely not. That's just a myth, like terrible thing about to say. Um, it's a minimal invasive procedure. It's a needle that goes through the ovary. Like, it's not likely affect on anything. And I have like done mares that been through OPU procedure and flushing after that, like weeks after the OPU procedure. You still get an embryo. It don't change on anything the fertility. That's just something that comes up with people talking about, but it's not related on anything. There's research proving that mares still capable to produce an embryo naturally after like multiple OPU procedures.
Okay. So if somebody was to have their mare go through an OPU procedure and then there was a delay, let's say, in them um, cycling again or have some poor run of results with a subsequent flushes, um, that could be related to other factors and not necessarily the OPU. Is that
Yeah,
correct?
no, definitely not. Mares tend to cycling really quick uh, after OPU. I normally scan around like 2 weeks after the procedure, and if you think about the aspiration, uh, multiple of the follicles that will be aspirated, they're gonna become cells. So for people that don't know, CL means corpus luteum, same as a natural ovulation. So it will probably count as a normal ovulation, and then 21 days after that, the mare likely to be in season again.
Okay. Okay. Um, and do the mares experience any pain or discomfort during the OPU procedure?
It's gonna depend on the mare. Some mares are more sensible. That's why it's good to have someone with experience to do it, because you're gonna know how to manage the sedation, the top ups during the process, also the pain relief, and how you're gonna follow uh, after the procedure is done, to make sure that the recovery and everything goes well without any problem.
Yeah, yeah. So when you say top up during the surgery, is that mainly with sedation or pain medication or a bit of
Yeah,
both?
it's just like sedation that we're going giving like during the process. If I would likely say the whole procedure it takes like around 20 minutes. Um, we do with the horse standing up. It's quick and like sedated the first thing, and then we put in the crush. It starts with like cleaning. We also put a bladder catheter to make sure the bladder is empty, so the mare will be like more comfortable in the crush. Uh, but and then it's particular for many mare how they gonna respond, and the vet will decide if like how many top ups you're gonna need to give it, or even is the case that the mare is too sensible, and the better option would be don't do it. We also have this in our contract that the vet have this responsibility to stop the procedure if he thinks it's get on risk.
Oh, that's good. That's good.
Yeah.
Yeah. And how long after the procedure is finished would um, a mare be? I guess would they be monitored? And then after that, how long would they stay at the clinic, or could they return home?
We normally like prioritizing the mare stay for around 2 days after the procedure in the clinic. Not likely. I have like done more than 300 mares. And maybe I saw one or two with like mild colicking after the procedure. That was solved in the following day, so not big deal. But like 99% of them gonna be completely fine. But we still following up with uh, temperature, make sure everything's going okay. They eating, drinking normally. And that's also important. Pain reliefs, antibiotics to control any problem.
Yeah. I've been to a few OPU procedures just to supervise, and so when you say to me, the magic is in the lab, um, yes, our side is important, but I tell you what, you really need a good team at
It
the
is, yeah.
OPU end, and I've certainly seen before. I guess kind of like a football match, you have everyone in the right position, and if you move one person out of position, say someone who's flushing gets changed, or someone that's on the needle gets changed, or the vet that's holding the ovary, if there's a shift there, I've noticed big effects on the results and the recovery
Yeah.
rate. So, yeah, it is a highly specialized procedure, and obviously people that are looking to get it done should be going to experienced clinicians
Yeah.
like yourself to get
Yeah.
that done for their
You
mares.
see,
So,
it's like pretty much like a football team.
mm,
Uh, After like you have the same team, if I'm doing the ovaries, someone's doing then it's like the sedation, someone's helping with the syringe. It's pretty much like a 3 people job. Uh, like after you do like a couple with the same team, you pretty much get everyone together. Like doing this, doing that. Like everyone know exactly how proceed with anything that happens.
yeah. And Danton, if you've done a scan and you see a mare and she's got a healthy number of follicles, uh, is there anything on the day of the procedure that may cause you to not go ahead?
Um, I have a couple of things. Um, First of all, be the number of follicles. That's the basic one. Uh, but I have also a couple other ways that I like to work. Um, Mares that just ovulate recently with like fresh CL, I'm more likely to do them when they come in a new wave of the cycle, when all the follicles are growing together. Not necessarily the mare need to be in season, but likely to be coming in. So it's hard in the routine to schedule everything. Sometimes we just need to do it. But if I can do PG to make them come in season and then do the procedure like 3 days, 4 days after that, I think that's the best time to do it because it's when you're recruiting all the hormones to the follicles and they're growing. I believe with that you can have a better maturation and better results in the lab because they more they more likely to grow better, I think.
Yeah. And Danton, OPU ICSI is not as widely used in Australia as, say, other parts of the world, certainly in Europe or the United States or even Brazil. I know that Brazil, there's a lot of OPU that happens there, OPU ICSI. Um, and some people might be a bit hesitant because the cost that's associated with the procedure, certainly then lab fees on top of that. Why would why should people go with OPU ICSI over traditional AI slash embryo transfer?
Mm-hmm. Uh, so more one thing that I always talk with our clients, we're not a ICSI only, OPU only clinic. So our goal is work with which one of them will have it as an idea of numbers of foals and embryos, you know, uh, what we have on hands to do. Uh, I will give an example to you. I just spoke with a client a couple weeks ago that I told her, like, ICSI, maybe it's not to you. Like, you have a good fertile mare. You want to work with a good semen. I don't see any reason for you to spend the money on that. Like, you still can get good chances on embryo flush. That might be a little cheaper for you. But in the other hand, the reality is not always that. Uh, you're gonna have clients that come to you with certain disappointment, I believe so, and they're gonna come and say, "I want from that stallion. I try a lot of breeding, like spend a lot of straws, nothing, or I have this mare that I have trouble already tried fresh, frozen." From multiple stallions, nothing's working. So with that, I think if you put on the paper, do the cost would be definitely cheaper, much cheaper to do the ICSI, and that's when we recommend the procedure and everything, because at the end with these problems, it's more likely you're gonna get an embryo from ICSI session than you got from a flush.
I think that's really important for people or breeders to understand that you guys do, as you said, it's not just OPU. You guys still do the traditional AI or embryo transfer, and that it is a case by case decision that's made, and sometimes it's best just to go with the easier methods, the artificial insemination or the embryo
Yeah.
transfer. ICSI should be my opinion, and for whatever it's worth, should be tried once these other options have been exhausted,
Yeah.
or if the availability of semen is so low
Yeah. And
that,
I
that
think it's our responsibility to be clear with everyone, uh, because we don't want people to have a wrong impression about the ICSI. So we don't want people jumping in this because another breeder is doing or whatever someone else is doing. Uh, I think you need to have a clear reason to do this. Otherwise you just keep going with the flush, what we normally do, and or AI.
Danton, let's talk about some misconceptions. Um, what are some of the questions that your clients will ask you, or some of the misconceptions that they might have about OPU and ICSI? Because I think that there might be others that could be watching this that will maybe have the same questions to ask.
Mm-hmm.
I think it'd be really good to speak to like have an expert like yourself speak to that.
I think multiple people that came to us with this question about, so like they not doing the winter because they think the mare would need to be in season or cycling to do it, and it's not true. Some mares are likely to get better results in the off season when they tend to have multiple smaller follicles and not just one big follicle that gonna ovulate. So for some mares, I recommend to do in the winter when they have like better follicles, but this is not absolutely true. It's particular from each mare. You're gonna have mares that gonna be better in the summer when they already like cycling and tend to grow another follicles as well. That's why it's important for you, like on my perspective as a vet, to have the knowledge to inform the people what's the best time to do. Hold your expectations as well. Yeah, and I believe there's another thing. Like people came to us and like, oh, we send 9 oocytes to the lab, So yeah, like I'm always working on 9 oocytes now, and they pretty much like, oh, so I would expect 9 embryos. Like, hold on, like oocyte is one thing, embryo is a completely other.
Yeah. Got no 9 oocytes, Mo. Give us 9 embryos,
Yeah.
and if it doesn't work, yeah, blame the embryologist.
Like
That's
I have
okay.
the updates that I give to the clients, and for everyone that say like, oh, that's oocyte. I mean, I don't mention embryo till the last message. Like I don't say anything about embryo till the last message that I send. Otherwise, you're gonna get a misconception.
Yeah, and I think that's really good to. It's hard because I'd imagine people would be itching to find out. I'm sure that after the procedure happens, you get a lot of questions. So, if you don't mind, Danton, I might just show some images. I think some people might be interested, to see what I see, and we can kind of talk through that. So, obviously, once you've done the successful OPU, and you've sent me a lot of oocytes, those oocytes will go through a process that we call IVM, in vitro maturation, and what I normally see is something like this, and people hope they can just bear with me. But
Hmm.
this is what we see is the cumulus oocyte complex, and this is after the maturation process, and you can see that those cumulus cells start to expand. They probably look a little bit more expanded than what you might see them at the
Yeah.
site of OPU. And at this point, what I'm looking for is mature oocytes, and it's hard to tell whether an oocyte is mature. So I actually have to gently strip these cells off. And in this process, if you're not careful, you can actually damage and rupture the oocyte. Um, Sometimes you can go as gently as you like, but it's gonna, some of them just rupture anyway. But we try and I try and do it as carefully as possible to avoid that, because in the back of my mind, I always think about that team that's done the OPU and have gone through all that difficulty to give the oocyte. So yeah, so this is what I get, and again, I strip those out, and then what we're looking for after that process is we're looking for a mature oocyte. And what do we mean when we're looking for a mature oocyte to do the ICSI? So I'm looking for a extruded polar body, and features within the cytoplasm that will demonstrate that there is what we call cytoplasmic maturation. So they're the two things that I can look for morphologically before going and picking a individual sperm and getting things to getting ready for injection. So this is a healthy oocyte. Once Danton and the team have gone through all that hardship of collecting the oocytes and growing them, this is what we want to see on my end. And sometimes we see some poor oocytes. So, and that's not a reflection of the OPU procedure, because at the end of the day, biology is biology. There's nothing really we can do about
Yeah.
that. So you are going to get those poor quality oocytes occasionally. Um, but hopefully, from what I can see, all the good quality oocytes get injected, and then just to your point, you were talking about telling your clients about uh, embryos and not saying anything, until you get to that end stage. So day 5, I do a cleavage check, and again, what we're looking for there is a sign of development. So after the injections have taken place, what we'll see is cleavage stage embryos. Um, but this doesn't really tell us anything at this point, unfortunately, other than they are doing something. Um, and here's an oocyte that's been injected, but there hasn't been any development, and that can just happen. as well. So we've got cells dividing. Will they reach the blastocyst stage, or the embryo stage? So what we need to keep in mind is, yes, these are embryos. They're cleavage or morular stage embryos, but they're not, the end product. And then, of course, what we're hoping for, if everything's run smoothly and everything in the lab has worked out well, which is you know, which is what you and I both desire, is then we're looking for something like this. So
Yeah, beautiful
this
embryo.
is this is an expanded embryo. This is what I vitrify and get on the phone and say to you, mate, congratulations. We are at this stage, but as you and I both know, this is not the end.
Yeah.
So we might have, really good embryos, um, but then it comes back to yourself, and we're looking at transfer.
Yeah.
So, and that's a whole nother side of things. Assuming, and it's not good to assume, because sometimes an embryo that looks really nice may not lead to a pregnancy, because there could be, again, issues with the DNA of that embryo. So again, it's not a comment, or should I say, a reflection on the clinical team, or the lab for that matter, because there's things that we ultimately can't control. But assuming that the embryo is viable, and it's been frozen and warmed appropriately, what are we looking for to give a success on the transfer side?
So yeah, well, like you just went through all the process, and you have so many steps, things that surprisingly you can have like good news or bad news. Even starting with OPU, like we go for around like 60% of recovery, oocyte recovery. So that would mean from if you got like 10 follicles, you can get like 6 oocytes around that. And then you like go to the lab that you have so many things that could get wrong or bad. So that's why like I always try to keep the clients on mind that you need to be ready for frustration, because uh, that's breeding is something that you need to be insisting a lot and really wants to do that to make it work. So it's not for anyone. It's not for people who dream about it and this and that. I mean, you need to have the conscience that things can go good or bad, and even when everything goes amazing, like we get good results in the OPU session, good results in your lab, that embryo came like beautiful embryo. We found like perfect recep, everything looks amazing. We're very likely expecting a pregnancy, but sometimes it doesn't happen. Or even sometimes we got and it lost in a couple of days or weeks. Unfortunately,
Mm.
uh, that's the that's biology. It's not as simple to explain. Um, we're going for around 60, a little bit more of uh, pregnancy rate in the ICSI embryos at the 14 days check. Um, but it's variable, depends on the embryo. So I normally prefer to go for like that embryo, that pregnancy. So it's 0 or 100, and not just put like all the bunch together and make numbers.
Yeah. And what has been to date your experience with transferring uh, flushed embryos made in vivo and ICSI embryos? I know that's a little bit of not a little bit, a very unfair question, because there
Mm-hmm.
are a lot of factors that can affect both. Um,
Yeah.
but assuming all the stars align the way we want for both the embryo transfer and the ICSI uh, embryos. Have you noticed any difference between in success rates between ICSI versus traditional embryo transfer?
Well, you're probably better than me to explain morphology of the embryo, like in vivo and in vitro embryo. Um, but I would say normally the pregnancy rate in recips would be around 80 to 90% in 14 days. Uh, with a better, like less chance than lost an embryo at before 45 days than you have in the ICSI embryo. Uh, but like I believe like today we're getting better media. They've like we knowing how to manage better the recips. That's why we're increasing the number, of Sussex in the pregnancies. We also working better dealing with the hormones to make that environment perfect, fine for the embryo to develop there. So we actually managing like doing anesthesia transfers, measures that are not in season, like you do like artificial cycle and make sure they grade well and you put like a good embryo on them that like you try to do your best with what you have in your hands um, to have the better chances for it's not because it's the client horse that we don't care. It's something that I know you doing your best, I'm doing my best, everyone's working together because we don't want to do the OPU again.
Yeah, 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 absolutely. Yeah, yeah. I think that's if there's one message that I hope that people get watching this is that everyone is actually trying really, really, really hard to get a result.
Yeah.
That there is no joy in a failed cycle for anybody, whether that's you guys in terms of your AI embryo transfer or the OPU ICSI side, because you're right, all of this is quite costly and it isn't for the faint-hearted. So if there are
Yeah.
people that want to breed, um, but just something that you raise in terms of the morphology. So just in case of people are interested in seeing, so this was again. I'll just bring this image up so people can see this. This was a in vivo, sorry, an in vitro produced embryo. Um, we can see the sort of the cuboid cells, around the edge, which is your trophoblast, um, and these are what will give rise to the placenta. The inner cell mass is quite dark, and it becomes very hard for us to um, sort of notice all of its boundaries clearly, or its boundary clearly, should I say? But if we were to say compare that to an in vivo embryo, um, there is a big difference in how it looks. So we can see, the trophoblast cells are a lot thinner, and the inner cell mass is just this section here. So this is what's going to lead to the foal, assuming that everything
Hmm.
works quite well. And there is actually, when I first got involved with the equine embryology, and I noticed such a big difference in the in vivo embryos. They're flushed and they're large. You see them with the naked eye.
Yeah.
I thought that was absolutely incredible. But the same embryo at the same stage that's produced in vitro is significantly smaller to the point that we still need a microscope
Yeah.
to see that. I've got some theories, around why I think that happens. Um, don't have the time to test those theories, but I have some theories. But I've often just wondered whether there was, whether you guys have noticed a difference in that
Yes.
success rate between the
And
two.
and that's the thing about Iximo. Everything is so recent. Everything it's so new. Um, if you go like embryo flush started in mares like 40 years ago, almost like 50 years ago, if you think about it. So you have like 50 years for researchers and everything. First time that I saw a ICSI procedure was in 2018 or 19 when I was working in America, and was getting to the point that the ICSI was getting out of the universities and start to be something commercially. So what I can see here in Australia now, we're pretty much pioneering on this. What you have done in your lab, what another labs and other vets are doing aspirating is fantastic. Uh, every day it's something new. Every day we're changing something for better results. Uh, so, you know, who coming first drink clear water? That's pretty much what we say in Brazil. Um, so, like, unfortunately, people need to go through the process to find out how it works. That's the only put in practice is the only way to find out if it works. Um, so I believe there's a lot of things to still develop. I would say if we have the same conversation next year, we're probably gonna talk a lot of different things that change in this meantime. So
Yep.
yeah, but like at the same way, it's an amazing technique. Uh, we're solving a lot of problems with that. We're going unfertile for years and years, and we're being able to get a foal in the ground from them. So I believe that's the magic. That's why since I was in university, I was always fascinated with the breeding, the teratogenology, with all that stuff, because it's something that it's just changing every day.
Yeah, absolutely, mate. And you're right. There's a number of groups in Australia that are working on improving our understanding of equine fertility. So, we've got a colleague up in UQ, Andres Gambini. They're doing a lot of work there. And I think there is a lot to understand, especially about, I guess if I was to be a little bit selfish and talk about, my kind of small area, embryo metabolics. Are we creating appropriate culture conditions? Because things, if you look at labs, even big commercial labs internationally, blastocyst development rates are anywhere between 25 to 30%. Sometimes they can sit around the 20% mark as well, and that remains stagnant. And even in the human IVF world, it's something similar. So if you look at the way culture systems are
Hmm.
designed, there's a lot of work that really needs to be done to better understand. Um, and as I said, just even those images that we saw, the difference between an ICSI embryo um, and a in vivo produced embryo is morphologically is quite different. Um, but aside from the morphology, what we want to do is produce healthy foals. And so, one question that people might have, Danton, is in terms of foal health, have you noticed any difference between an ICSI foal and an in vivo embryo foal?
No, no. From my experience, even falling down exit falls, uh, I don't see anything as a problem related that you can say like that's a ixiphol problem. Even in terms of placenta, like intrauterine things, that it's hard to deal with that. I'm not the best person to talk about this, like, but uh, yeah, there's research also proving that's just histories that come up with people talking about ixiphos not be as healthy as a normal foal. Uh, but in the practice, I don't see that. what you see nowadays, it's probably like you have sick foals. You can have like AI or a cover like a thoroughbred foal that was like not even an AI uh, that doesn't born healthy, but it just happened, and people like to blame because it's ICSI is more likely to
Hmm.
don't get as healthy as a normal one, but this is not true.
Oh, that's good. That's reassuring, because the last thing that I think any of us want to do is produce unhealthy animals,
Yeah.
and yeah, we
And
definitely
also
want to avoid doing
because
that.
it's such an expensive process, so you're just going through all this because you're expecting a valuable foal. So people will put the money on and like do properly falling down, same as we do in our hospital here. So you don't want to take the risk for waiting 11 months, go through all that thing to, have a foal that born and die or something like this. So you want to be as safety as possible.
Yeah, absolutely, absolutely. Um, yeah, there is a lot, as you said, a lot that we're still learning about the process, and I think that can be said about even the commercial labs internationally. That I don't think that we can get to a point where we say we understand it all. Definitely not true. But from my end, working with veterinarians like yourself is a real pleasure, and what we're hoping to do together and with other people throughout the country is to provide a service that people can go to, that they know it's safe, that they know the OPU is being performed by experienced clinicians, and I would really recommend anyone to get on the phone to Wood Grange and ask to speak to Danton and get more more
Yeah.
information. So I hope your phone explodes, mate, and then you can complain to me
Yeah, no,
about
we
that. But
definitely like really help like we really want to get sorted any question that people have. We have people calling us, and like I sometimes stay a little bit longer in the phone and go through all the process and everything. Um, and but I always say like you're just gonna get through the process when you have done 2, 3 of your mares, and then you're gonna understand like, oh, don't update me about maturation, though. So that's the first step. And then he gonna update about injection and the cleavage, and so like you're just gonna know exactly how the process works when you jump in, and you be part of that. Not just you can spend hours learning about it, reading about it, but you need to jump in, and then as a breeder, like breeders gonna get into that when they started with their own mares.
yeah, I guess with each mare is different, and to your point,
Yeah.
the only way you're going to know about it is your mare might be, well, not might be, it will be unique, and she will have different results,
Yeah.
hopefully
And
better.
people still like to compare with Europe or America or Brazil, and they would say like, oh, but they got like this or that, and it's sometimes not the reality. I just have a friend another day that I was speaking. He have a couple mares in America, and he was going through big lab there, and he's like, oh, that's not the results I was expecting, but they still advertising. So I think people will need to be aware, of the results. That's what I'm tell everyone. That's the first thing you're gonna say. Oh, what I can expect from ICSI. Like you can expect zero, or you can go for 3 embryos.
Mm.
But I cannot guarantee anything in this process.
Yeah. Well, to give you an idea, mate, we had one client. Uh, they, I think, tried for a couple of seasons with the normal flush. Um, no embryos at all. They came to the lab. The first OPU procedure that they did, we were able to get 3 embryos for them. All three of them were transferred. All three of them led to fetal heart. Brilliant.
Yeah.
That same mare has gone again a couple of times. No embryos. No ICSI embryos. So, which is kind of frustrating because you think, all right, we're on a winner here. But unfortunately, we didn't get a result for
Yeah.
them, in the subsequent ICSI cycle. And I go crazy because I run through everything in the lab, check the culture media, the conditions in the lab, air quality, you name it. There's a lot to it. The clinician that we're working with, again, went through everything as well. But as we said earlier, sometimes biology just doesn't matter what you do, just won't give us the result that we want. So,
Yeah.
yeah, I think it's important for people to speak again with clinicians and to get a realistic
Hmm.
view,
Yeah.
and not to get too excited. Your mare may perform better or worse than
Hmm.
somebody else's mare, so it's only really gonna
Yeah.
you're only
I
really
like.
gonna know that once you go through it. Yeah.
I have mares that came to me with like 7, 8 flush, like negative flushes, and for nothing. And I know we've spoke about this, like, okay, we got an embryo and you still need to put in a recip. It's a risk, but you went, for example, so many flushes for nothing. I mean, you got an embryo in your hands now, so that means a lot. You know.
Yeah. Yeah. Absolutely. All right, Danton, mate. I'm gonna get out of your hair. I really appreciate the time that you've given me today, and I know that people watching this will find this valuable, find your information valuable, and without a doubt, I will be asking you to come on again. I hope you'll agree.
Yeah, sure.
um, yeah, and yeah, we'd love to. If anybody has questions that they want to ask, please send them through. Because as Danton was saying earlier, sometimes he might get a question that it just they have people haven't thought of before, or like you might go through as a clinician, or I know that this is it, and then somebody can ask you a question and just, oh, okay,
Yeah,
I've got to
yeah,
see
absolutely. I
if
think
there's.
we just had this idea another day, and when people start to ask about labs and cleavage and this and that, it runs a little bit out of my expertise. So, and then I go through Mo, and they like, Mo, that's the thing for you. But I think we're pretty much working together on like to go for the best results as possible. So yeah, if anyone will have any questions, and we can even have a Zoom together, solve any question about it.
Yeah, absolutely, and I think that Woodgrange, you guys were looking at having an information day. So please let me know if you guys end up doing something like that, and we'll try and share that.
Hmm.
And if I can help with providing any information from the lab side, um, I'd be more than happy to do that. So yeah, again, we're just trying to do the best thing by all the breeders, and hopefully get people the results that they want. And if it doesn't work out, the the saying is, if it fails, blame the embryologist. All right, mate. Well, look, you have a good night. Thank you for your time, and we'll talk soon.
Thanks, Mo.
See you, Dan. Bye, mate.
See ya.